myself Dr. Kanak Modi. I am working in UNMICRC Institute of Cardiology and Research Center. Today, under the continuous physiotherapy education, my topic is airway suctioning. What are the topic of suction procedure, precaution while suction, AT tube and T-stomy tube care. Suction procedure. Suctioning clears secretion from the airway of patients who cannot mobilize and expectorate them without assistance. It involves aspirating secretion through a catheter connected to a suction source. What are the type of suction? There are mainly 6 types of suction. First one is endotracheal tube, open and close. Closed one is done by Suctioning-Cpe. Second one is tracheostomy tube suction, open and closed, oral suction, oropharyngeal, nasopharyngeal, and last one is nasotracheal. What are the purpose of suctioning? To maintain the patient airway by removing accumulated secretion using sterile technique. To improve the oxygenation and reduce the work of breathing. Stimulate the cough reflex, prevent the infection and atelectasis from the retained secretion. What are the indications of the suction? Increase the peak inspiratory pressure, decrease the tidal volume, reduce the air entry or noisy breathing during the auscultation, mainly rhonchi sound, visible secretion in the airway, alter the arterial blood gas values, suspected aspiration of gastric or upper airway secretion. What are the anatomy and physiology? Upper respiratory tract, nasal cavity, pharynx, larynx, lower respiratory tract, trachea, primary bronchi and lungs. What are the size of suction catheter? Orange 16 number, green 14 number, white 12 number, black 10 number, blue 8 number and light green 6 number. Orange, green and white number mainly used in adult male or female, where blue and light green mainly used in pediatric patient. ET tube suctioning. ET tube suction is defined as the procedure to remove the pulmonary secretion mechanically from the patient's airway passage via nose or mouth where endotracheal tube is in place. Endotracheal tube. It is an artificial airway inserted into the trachea through the mouth or nose, usually made up of polyvinyl chloride. What are the size of tube? It's available in various size 2.5 mm to 8.5 mm. The size is indicated by the internal diameter in millimeter. 8 to 8.5 mm internal diameter used for adult male and 7 to 7.5 mm internal diameter used for the adult female. Procedure of ET suction. Pre-oxygenate the patient before suctioning, 100% O2 for 2 minutes. Assess the patient before, during and after the suctioning. Mainly vitals, awareness and monitors. It's important to insert the catheter without applying suction. Applying suction on insertion could injure the airway. After you insert the catheter, apply suction while using a rotatory motion to remove it. Insert the normal saline or mucolyte if you found clot or found blockage in tube. Hyperventilate the patient with ambu bag in between the procedure if required. ET tube suction precaution. What are the precautions we have to taken during the suction? Vacuum pressure of up to 360 mm Hg gives good result. The general recommendation is to use between 70 and 150 mm Hg, except when there are thick secretion where up to 200 mm Hg is used. Use a suction catheter that has an external diameter less than 50% of the size of the endotracheal tube inner diameter. The catheter is inserted until the beyond the tip of the endotracheal tube or until they touch the carina. ET tube care. Observe the sign and symptoms of need to perform ET tube care. Soiled or loose tap, pressure source, lips or corner of the mouth, excessive nasal or oral secretions. Observe the factor that increase the risk of complication from endotracheal tube. Size of endotracheal tube, movement of tube up and down trachea, in and out, duration of the tube placement, cuff over inflation or under inflation, presence of facial trauma. ET tube care. Assess the patient knowledge of procedure if he and she is aware. Ask the another nurse assistance in the procedure. Explain the procedure and patient participation, not biting or moving ET tube with tongue, not to cough when tap is off ET tube, keeping hand down and not pulling off tubing. Removal of tap from face can be uncomfortable. What is the Tracheostomy tube suction? Tracheostomy suctioning is defined as the procedure to remove the pulmonary secretion mechanically from the patient's airway, passes via trachea where tracheostomy is in place. Tracheostomy tube, it is an artificial airway inserted directly into the trachea. Tracheostomy. What is the tracheostomy? It is a surgical opening between second and third tracheal ring into the trachea below the larynx. We can see in the figure, tracheostomy tube is inserted just below the cricoid cartilage. Procedure of tracheostomy suction. Pre-oxygenate the patient before suctioning 100% O2 for 2 minutes. Assess the patient before, during and after the suction. Vitals, awareness and monitors. It's important to insert the catheter without applying suction. Applying suction on the insertion could injure the airway. After you insert the catheter, apply suction while using a rotation motion to remove it. Insert the normal saline or mucolyte if you found clots or found blockage in tube. Hyperventilate the patient with ambu bag in between the procedure if requires. Tracheostomy suction procedure. Suction catheter to be insert approx pence length into tracheostomy tube to avoid the trauma, at least not more than 1 cm beyond the tube length. Suction vacuum pressure less than 150 mm Hg. Select the suitable suction catheter. Tube dislodgement. Be careful about the tracheostomy tube and make sure it won't dislodge. Once tube is in situation more than 1 week, the track is usually worn from the and will not close the over straight away. Call for help. Inform appropriate person. While waiting for help to arrive, reassure the patient. If patient desaturates, administrate O2 via stomy. If stomy appears to have closed the over, try via face mask. What are the general precautions? Your suction catheter should not touch any surrounding area. Don't forget to turn on ventilator if standby, otherwise don't stand by. Insert the catheter gently and when you feel and take catheter out immediately. Don't pinch. Be aware about the blood reports and count in specific patient. Suction duration of 10 to 15 seconds for adults and 5 to 10 seconds for pediatric patient and neonates. Closed suction. It is a system with an integrated cleaning mechanism on the catheter. Closed suction system keeps the endotracheal tube clear. Closed suction. Don't allow the secretion to build up without breaking the ventilator circuit. Maintain a clear and clean airway during the entire period of mechanical ventilation. Can be attached to patient with tracheostomy also. Prevent the infection. Oral suction. Insert the suction catheter into the mouth, advancing slowly to the back. If patient start to cough or gag, wait until the patient recovers before continuing. Never suction for longer than 15 to 20 seconds. Keep proper oral hygiene during the whole day. What are the complications of the suction? Hypoxemia, decrease the O2 in the blood. Cardiac arrhythmia, pulmonary tract infection, it is the most common. Sepsis, injury to airway and cardiac arrest. Care of suction machine. After suctioning, the patient suction water through the suction catheter until the catheter and tubing are properly clear. Never allow the suction container bottle to raise above the fill limit line. Suction tubing and container should be changed daily. Your equipment must be disinfected every third day. Thank you. I would also like to thanks to my department and my faculty member.